In 2023, the U.S. healthcare sector will face a dramatic upheaval brought on by technological advancements, demographic changes, and changing patient expectations. This screenplay will offer a thorough examination of the current situation of the U.S. healthcare sector, look at significant healthcare trends, and provide insight into the development of digital health in the future. A summary of the U.S. healthcare sector for 2023. Increasing healthcare costs and their effects on the economy. The effects of an aging population on healthcare delivery. The difficulties with obtaining affordable healthcare. Technological developments and their effects on healthcare. Machine learning combines artificial intelligence, AI, for improved diagnosis and tailored healthcare. For greater accessibility and convenience, consider telemedicine and remote patient monitoring. Blockchain technology for safe and reliable exchange of health data. Healthcare trends for 2023, Part 2. Concentrating on value-based care. The change from fee-for-service reimbursement structures to outcomes-based approaches. The significance placed on population health management and preventive care. The inclusion of socioeconomic determinants of health in the provision of healthcare. Engagement in care that are patient-centric. The ability of patients to take control of their health data. Customized treatment plans and shared decision-making. The growth of patient support and advocacy groups. Healthcare industry integration and consolidation. Acquisitions and mergers between insurance companies and healthcare providers. The establishment of accountable care organizations, ACOs, to coordinate care. Streamlining care delivery through vertical integration of healthcare services. The future of digital health. Machine learning and artificial intelligence in healthcare. Predictive analytics and diagnostics enabled by AI. Optimization of care and personalized medicine. Robotic surgery with AI assistance and digital nursing assistance. Telemedicine's promise and remote patient monitoring. Bettering the availability of healthcare in underserved places. Enabling virtual care delivery and distant consultations. Monitoring chronically ill patients regularly. The development of wearable technology and digital therapies. Real-time monitoring and management of health. Prescribing digital treatments for persistent illnesses and mental health. Enhancing self-care and patient involvement. Protecting security and privacy in the age of digital health. Safeguarding patient information in a networked healthcare system. Observing legal standards including GDPR and HIPAA. Fostering mutual trust between patients and medical professionals. Opportunities and challenges. Policy ramifications and regulatory obstacles to the deployment of digital health. Closing the digital gap and guaranteeing fair access to medical technology. The COVID-19 pandemic's effects. How the pandemic has affected the provision of healthcare. The swift use of telemedicine as the main method of treatment during lockdowns. Increased use of contact tracing and symptom tracking digital health tools. The quickening of virtual consultations and remote monitoring to reduce exposure. The resilience of the healthcare system and lessons learned. Enhancing crisis response and emergency preparedness capacities. Improved coordination between public health organizations and healthcare providers. The significance of collaborations and information exchange in global health. The necessity for comprehensive care in the face of mental health issues. Increased need for mental health treatments as a result of the pandemic's psychological effects. The inclusion of mental health services in settings for primary care. Social determinants of health and health equity. Access and performance disparities in healthcare. Inequities based on race and ethnicity in the use of and results from healthcare. Health disparities are influenced by socioeconomic factors. To alleviate health inequities, there is a need for focused treatments and legislative changes, taking social determinants of health into account. Collaborative methods including community organizations, social services, and the medical field. Supplying means of transportation, housing, food security, and education. Use technology to close gaps and enhance access to healthcare in marginalized communities. Development of the healthcare workforce and skills. Filling the shortage of healthcare personnel. Forecasts predict rising demand in a range of healthcare professions. Utilizing techniques for workforce development and recruitment to address shortages. Promoting inclusion and diversity among healthcare workers. Training and literacy in digital health. Providing training in digital health for medical professionals. Encouraging ongoing learning and professional growth in digital healthcare. Working together with educational institutions to integrate digital health into the curriculum. Ethical issues in digital health, Section 8. Data ownership, consent, and privacy. Weighing the advantages of health data against people's right to privacy. Frameworks for data governance that are open and rules for informed consent. Allowing patients to take control of their health data. Algorithmic bias and AI. Ensure the equality and openness of AI algorithms. Reducing biases in decision-making based on AI. Involving various stakeholders in the creation and evaluation of algorithms. The landscape of policy and regulation. Understanding changing regulations. And modifying healthcare regulations to account for advancements in digital health. Juggling regulating control with promoting innovation. Policymakers, business, and healthcare experts working together. Digital healthcare reimbursement schemes. Reviewing and updating payment systems to incorporate digital health solutions. Value-based payment schemes for remote monitoring and telemedicine. Ensuring that all patients have access to and can afford digital health services. The change to patient-centric, value-based care that will characterize the U.S. healthcare sector in 2023 is being driven by technological improvements and a growing interest in digital health solutions. In addition to underlining the significance of tackling health inequities and social determinants of health, the COVID-19 pandemic has expedited the development of telemedicine and remote monitoring. It is essential to ensure privacy, equality, and ethical issues in the design and deployment of healthcare technology to realize the full potential of digital health. The U.S. healthcare business may continue to develop, improving health outcomes and providing more accessible and equitable treatment for all through managing policy and regulatory barriers, investing in the healthcare workforce, and encouraging collaboration among stakeholders.